Hi, I just want to talk to you a little bit about some ancillary classes that we have that are not required by the certification board but are very vital to you being a successful professional in this field. Psychopharmacology and neurochemistry will help you understand and get a kind of idea of how the brain works and what substances work on what part of the brain and what medications help those parts of the brain work better. There's specific medications that work for cravings. There's specific medications that help with post-traumatic stress disorder. There's specific medications that we use during a post-acute withdrawal protocol, because it's really important that we get the clients comfortable. If we don't somehow settle them down, get the brain chemistry to cool down, they're not going to be able to engage in treatment. They're not going to be successful. You know, one of the biggest questions that family members ask is, why can't they stop? Why can't they just stop? And the truth is, you're going to learn why they can't just stop and what we can do to help them. You're going to have to address the dual diagnosis, the depression, the bipolar, and all the other components of addiction as you're working with a client. And it's really vital that you understand how medication helps and works. There's certain chemicals like, say, alcohol and benzodiazepines, and they hit the GABA center. GABA is the main center that they trigger, which triggers dopamine. With the GABA, there's medications that specifically work with GABA, such as Neurontin and some other components. So understanding this full spectrum is just really, it's essential to being an effective clinician. It's also something that makes a big difference. A lot of people don't understand why we have to put the clients on medication. Should they be getting this much medication? Why are they taking all these things? And taking a pharmacology class will help you to understand why they need the medication. You know, it's not just about preventing seizures. It's also about slowing down the brain enough that they can interact, get settled in, and do what they need to do to change their lives.